Okay, so in this module, we're talking about forensic assessment, treatment, and consultation, and how a forensic assessment or how a forensic psychologist is involved in forensic assessment. So as you look here, the focus on gathering information about an examinee to make a diagnosis or conclusion about his or her current psychological functioning is probably the first step, that's the focus of what we're doing in assessment. This is also, as it says, to inform the court. Back to that term. Interviewing, psychological testing, gathering archival third-party information are some of the important tasks, and we'll talk about a few ways that psychological testing is done. Important task in forensic assessment is clarifying and identifying the legal question, making forensic assessments legally relevant. That's the important thing. We've got to find the connection in order for it to better answer that question, and more specifically what that question is. Assess whether forensic psychology has something to assist the court. Example might be a client's ability to assist the attorney during the trial. We're assessing that client in terms of, are they cognitively able to, are they intellectually able to, are they emotionally in a place to be able to assist the attorney during the trial. So the core concepts in assessment are reliability and validity, and psychometric soundness of tests and procedure. Reliability, as it says there, consistency of the measurement. Does the test consistently measure what it's supposed to measure, or give a score that's similar? It says similar scores each week on the BDI-2. If it's reliable, the scores are going to be very similar the multiple times that we assess using that particular test. Validity, in order for the BDI-2 to be valid, it needs to measure depression and not something else. So is it giving a good measure of depression? So those two components are very important. Accuracy of the measurement, we want to make sure that there's some validity there. Scope of practice, encourage forensic psychologists to practice within their scope. In other words, what area am I proficient in, and not to involve myself in areas that I might not be. If I don't have much child development work and history working with children, then working in custody evaluations is probably outside my scope of practice. Or if I don't have a lot of work in mental health, I might stick to something that's more civil-based, or outside of mental health, specifically mental disorders. So we got to remember to stay within the scope and not try to do everything we can do. That's true of clinical work too, y'all. There are certain things that I work with, and there's certain areas I don't. I'll give you an example. Borderline personality disorder, I'm not skilled, and I don't know the specific modalities to treat borderline personality disorder, so I refer it. I find somebody else who has the ability, and it falls within their scope of practice. So when it comes to the question of therapeutic versus forensic assessment, there's some differences here. When it comes to the goals and objectives, when it comes to a therapeutic assessment, we're gathering information to reduce psychological suffering. The forensic assessment, it's to address a legal question. The relationship of the parties in a therapeutic assessment is one of care and support. You're there to help. You're there to do everything you can for your client to help them get better, to help them achieve the goals they want to achieve, etc. Forensic, it's investigative and truth-seeking. It's not so much of support and care. There's a different rapport that's being established, and it's much more, I guess, straightforward, and it does lack some of the care that you would see in a therapeutic assessment. Identify, or identity of the client rather. Your client is the examinee in a therapeutic assessment, where in forensic, it could be the individual seeking out and pays for the services. For instance, and quite oftenly is the attorney. The consequences, design and intervention with therapeutic assessment. It helps us decide what types of treatments are going to be more beneficial and helpful. Forensic assessment, we're talking about financial or loss of liberty or life. That's what's at stake in a forensic assessment. So a little more heavy in what we're dealing with. Examinees' perspectives, therapeutic assessment, more important source, heavily relied upon. It's more voluntary. people come in on their own accord for help or assessment. Where with forensic, heavily scrutinized examinee, accuracy is a bigger question, and it's often involuntary. Or if they're supposed to show up for a forensic psychological evaluation, that doesn't mean they're necessarily going to show up. So it's a different animal altogether. When interviewing, different types of interviews, unstructured. There's no script to it. It's good for establishing rapport and gathering information in the kind of a casual conversation. However, inconsistent because of individual differences between psychologists, allows interviewer to follow up on responses and ask additional questions. So it's kind of like going for a job interview where they're not going literally reading off a script, but they're gathering information as they have a conversation with you, get to know you, establish rapport with you. Semi-structured, predetermined questions with flexibility for answering questions and making additional questions. So there are some stipulated questions to be asked, but you can ask additional or you can follow up. The PCLR, Psychopathy Checklist Revised by Dr. Hare, who developed that, divided into domains like educational history, family history, occupational history, etc. But you can add questions provided for the interviewer to ask if he or she chooses based on the examinee's initial responses. So there's some flexibility within a semi-structure. And then you have the structured, more formal, rigid, not allowing to deviate from prescribed questions. They're set in stone. You ask what those questions are. You don't follow up. You don't ask them to go further with it. The SIR S2, Structured Interview of Reported Symptoms, is an example of that. 172 questions that assess whether an individual is feigning or exaggerating symptoms of a mental illness. Told they must answer each question with yes and no response, no additional questions, or responding to examinee. Purpose is focused, clear, and not for establishing rapport and trust. This is not a warm, happy interview. This is a straightforward, we're going to find out if you're faking, if you're malingering, if you're feigning. So different types of interviewing for different types of folks. Some of the common tests we use are kind of clinical-based scales. They're used in clinical psychology. They're also used in forensic psychology. Personality tests are the most common, measure aspect of normal personality or psychopathy, mental illness. Forensic psychologists may administer in cases with legal requirements for presence of mental illness, insanity, civil commitment, some personal injury cases also. So it is the most common form, and the MMPI-2 is probably the most common used clinical scale you're going to see. Projective tests present ambiguous stimuli. It's kind of like taking a psychological X-ray, although it's low on reliability and validity. Some examples of the projective would be the Rorschach ink blot test, which you'll see a picture of in a second. And you guys are also doing this test within our course. The thematic apperception test, I like. It's lengthy. It takes a while to take. I'll show you an example in a second. And then you have something called an objective test, which is more structured, direct, higher reliability and validity. Yeah, they're much better in terms of reliability and validity. Require higher level of literacy and cooperation, more limited view of human behavior. Yeah, you don't get the ins and outs of the behavior, but it's more direct forward, and you can ask quite a few questions in a very structured form. Other types of psychological tests, intellectual, death penalty cases, an IQ below 70 is what we look for as being below that I guess you could say with mental capability below average, well below average. The Welsher Adult Intellectual or Intelligence Scale 3 is a good selection that we use for intelligence testing. Neuropsychological, we assess underlying brain deficits. Competency to stand trial might be an issue with that. An example, long-term memory problems. Neuropsychological testing is on the forefront. It continues to grow. We're learning more. We use things like a functional MRI, an EEG. We're able to look at blood flows of the brain. We're able to test the brain in lots of different ways. So as we progress into more, as this field continues to expand, you're going to see neuropsychologists getting more heavily involved in helping us understand some of these brain functioning issues that we can't get through simply testing. This is an example of the Rorschach ink blot test, and it says, what do you see in this figure? Do you see green seahorses or a pair of blue spiders? A psychologist who relies on the Rorschach test would examine your responses to find out who you are. There is no correct or incorrect answer. It's just what we answer says something about us. It's like we're projecting ourselves onto the material. It's ambiguous. It could be one of multiple interpretations. But what we see says something about who we are. That's kind of the idea of the Rorschach. This is the one I like, the thematic apperception test. It's ambiguous, but you get to see more of you can develop more of a plot line to the picture. And we tell a story about this, and the psychologist will assess that story, will evaluate that story, will make interpretations based on that story. And we'll see many of these. It's not just one. Like the thematic apperception test, you'll go through 10 or 12 images and tell 10 or 12 stories. The same with the Rorschach. You're doing multiple stories or multiple interpretations. So they're going to look at the themes. They're going to look at what are some of the consistent things that come up in all these stories you tell, or all these images you saw in the ink blots. Was there some type of theme of death, or was there an underlying deeper theme of insecurity? Was there something that had to do with fear that was involved? We analyze it that way, and I like them. They're kind of interesting, but there's a lot. Like I said, there's a lot that we can see in this that might not. The interpretation by the psychologist is scrutinized quite a bit.